Hey guys, welcome back to Bariatric's channel. Today we're going to talk about revision surgeries. A revision surgery is a procedure to help correct any problems that are associated with your current weight loss procedure. The most common reason for a revision surgery is when you don't experience significant weight loss after your initial surgery. But people also have to have revisions done when they're having issues such as ulcers or leakage or any other complication that can come from the original surgery. And the most common one we see is with lat band. A lot of times the band can start eroding and it can start slipping, so people have to actually get it removed. A lot of times people actually convert from a lat band to gastric sleeve if something like this has happened. It's a little harder for gastric sleeve patients and gastric bypass patients to do a revision. So a lot of times you see people who have gastric sleeve done, they actually convert to gastric bypass. For gastric bypass, there can actually be a formation of an opening, which can prevent weight loss and it can cause really severe abdominal pain. And then finally with gastric sleeve, there can be a leak that's formed. That's why you see after surgery, we get those procedures done to see how fluid is going through our new stomach, because they have to make sure there's not a leak. Having those leaks can cause things like abdominal pain, back pain, pelvic pain, hiccups, fever, and rapid heart rate. A lot of times people who have really severe deficiencies have to get a revision done as well. Now, as I said, lat band is the most common procedure where we're seeing revisions done, mainly because it's so easy to do it because you're just removing the band. Whereas gastric sleeve, if you're having different issues, a lot of times they just go straight to a conversion to gastric bypass. As a gastric sleeve patient, it's relatively easy to convert to gastric bypass. And a lot of times people also convert to duodenal switch. Now, it's not very common that revision surgeries are done, so don't let this video scare you and think that you're just gonna have to have another procedure or get your procedure reversed. It's not very common. People do have issues though. A lot of times people who have a severe acid reflux end up converting from gastric sleeve to gastric bypass. And like I said earlier, things like ulcers or leaks, those types of things tend to make it to where you have to have that revision done. Revision surgeries can be really helpful for patients because it can get people back on track to losing that weight after surgery. So if you're considering doing a revision surgery, I highly recommend you do some research on the procedure and what your options are, and talk to your surgeon because they're gonna have the best advice to give you of how to actually navigate through that. All right, y'all, that's gonna be it for today's video. I hope you found this helpful. And like I said, if you're thinking of having a revision surgery, talk to your doctor, talk about those options that you have, and that way you can get back on track with your weight loss. If you enjoyed this video, please give it a big thumbs up and make sure you hit that subscribe button so you don't miss out on any new videos. Thank y'all so much for watching, and I'll see you soon.